This turpentine oil has these isoprene units, and these isoprene units are used as a paint thinner in the form of turpentine oil. So if some accidentally some paint has been stuck onto our hands or feet, then we'll rub it off with the turpentine oil so that it is terpenes, sesquiterpenes, like that. So all these are synthesized from these units, which are called as the isoprene units. So we know that cholesterol is a kind of steroid which can be synthesized from these units, which are called as the isoprene units, and all mammals are able to synthesize this cholesterol, and this cholesterol can be the precursor for many of these biologically significant compounds such as the vitamin D3 or steroidal hormones or bile acids. So we can synthesize lot of compounds with cholesterol as a precursor, but this cholesterol has another important precursors which are called as the isoprene units. Okay, we'll move further. So then the cyclization of the steroidal nucleus will make us to create this cholesterol. So, yeah, so this is the structure of cholesterol. So this is the I'm going to discuss about the step 1. So this is step 1, the synthesis of mevalonate from acetate. So where do we get this acetate from? We get this acetate from acetyl CoA. So you can see here, even we have discussed this in case of the ketone body synthesis. So we know that two molecules of acetyl CoA can combine to form acetoacetyl CoA. So one more acetyl CoA will combine to form HMG CoA. This HMG CoA is a basic compound which can be converted into mevalonate. So this is a 1, 2, 3, 4, 5, 6. So 6 carbon compound, this mevalonate, and this is the starting compound of this synthesis of cholesterol. Now this HMG CoA will play a prominent role because this has two functions. One, either it can form the ketone bodies or it can form the basic compounds for cholesterol synthesis. So up to this part it is common for both. So acetyl CoA molecules, two acetyl CoA molecules will combine to form acetoacetyl CoA. Then one more acetyl CoA is attached here onto this acetoacetyl CoA to form the HMG CoA. This HMG CoA, upon reduction, it will form the mevalonate. It will form the mevalonate. This is the stage 2. So conversion of mevalonate into two activated isoprene units. So you can see here, this is a mevalonic acid or mevalonate. So how many carbons? 1, 2, 3, 4, 5. These mevalonate will again converted into this phosphomevalonate. So only there is a addition of this phosphate here. So if we want to attach the phosphate, we have to utilize one ATP here. So synthesis of cholesterol is a energy spending reaction. So we need to spend energy to produce a cholesterol. Again, there is one more addition of one more phosphate, which is called as pyrophosphomevalonate. So there are two additions of two phosphates. Then like that, many of these compounds, like 5 different mevalonate pyrophosphates are produced. It is activated. There will be condensation of this farnesyl pyrophosphate. Two molecules are utilized here. Then there will be formation of squalene. Here, if you can see here, there are 6 isoprene units, and this is a structure of squalene. So you can see this is a linear structure, but it is represented because it will be easy for us to understand, and the cyclization, it will be easy for us. So it is represented as like this, but it is a linear structure. what happens? This conversion of squalene oxide is again converted into further compounds like this. There are a lot of compounds, uh, stigmasterol, then ergosterol, then lanosterol, and again ultimately we are going to get cholesterol. So this is the final compound what we want. This cholesterol. So this is the amount of LDL or VHDL or VLDL present in the human body. Just stats, you can just go. So testosterone is a male hormone, whereas estradiol is a female hormone. But it's not that testosterone is absent in females. No, there will be presence of testosterone, but all the testosterone will be converted into estradiol, right? So if there is a presence of testosterone, because if it is not able to get converted into estradiol, then we say such condition as a menopause. We say that condition as menopause. So where there is a dominance of this male hormones in the females, this condition is called as a menopause. And there is one more fate of this progesterone. This is converted into cortisol, which is called as a glucocorticoid, and this affects the protein and the carbohydrate metabolism, and which suppresses the immune response or inflammatory or allergic responses. So these glucocorticoids, so they are secreted from the kidney, and they will reduce the inflammation. They will reduce the inflammation, because we know that our body has, so this is like an immunosuppressant activity. This is like an immunosuppressant activity. Then this progesterone can be converted into corticosterone, which is a mineralocorticoid. So we know that the glucocorticoid and mineralocorticoid, there are two kinds of hormones that are secreted by this cortex of this cortex and the medulla part of this uh, adrenal glands, which are present over the kidneys. So there are presence of this glucocorticoids and mineralocorticoids. So if our body has to able to synthesize this glucocorticoids or the mineralocorticoids, then cholesterol is a basic structure. So this cholesterol is converted into pregnenolone, and this pregnenolone is converted into progesterone. This progesterone can be converted into three things. One is cortisol, then corticosterone, and testosterone. So this testosterone is again converted into estradiol only in the case of females. So know that both in females and males there is a presence of progesterone as well as testosterone, but in males this progesterone is totally converted into testosterone. In females this totally testosterone is converted into estradiol, like that. Then this corticosterone is converted into aldosterone, which is again a mineralocorticoid, then which regulates the reabsorption of sodium, chloride, bicarbonate, as well as other forms present in the kidneys. So in other kidneys will act as a filters. They will be filtering around 180 liters of water per day. And if you want to reabsorption of sodium or other important minerals, then this aldosterone will help. So this aldosterone is also called as the mineralocorticoid, because it is helpful in the absorption of minerals, especially sodium, uh, chlorine, potassium. So we know that there is an exchange between the sodium and potassium. So reabsorption of sodium, chloride, and bicarbonates will be regulated by the help of aldosterone in the kidneys. Next, so this slide showcases how this cholesterol is converted into progesterone or pregnenolone. So these are the one two-step process. So here there is an involvement of lot of uh, compounds like NADPH and oxygen. So we require most of the oxygen. So because we have to oxidize these compounds, see here this oxygen is added. Then Again, there is an involvement of NADPH. So we can get this NADPH from HMP shunt pathway or the pentose phosphate path. So there we can see here this the formation of NADPH, and these are helpful here in the oxidation of cholesterol to make dihydroxycholesterol, and this dihydroxycholesterol is utilized in the presence synthesis of pregnenolone, and we know from this pregnenolone we are other compounds. So you can see here, so cholesterol is converted into 7 hydroxycholesterol, and this 7 hydroxycholesterol can be converted into cholic acid and uh, keynote D. Sorry. So we know that we are going to discuss about the clinical significance of cholesterol. So clinical significance, we have two things. One is hypercholesterolemia and hypocholesterolemia. So hypercholesterolemia is the condition where there is an increased concentration of cholesterol. So elevated levels of cholesterol in the blood is called as hypercholesterolemia, and this may lead to atherosclerosis. We have already discussed, which may also has the increased risk of having the heart strokes or angina pectoris, or we may also have the peripheral artery disease or congested cardiac failure, and it may also lead to a condition called as angina pectoris, which is means by a pain in the chest region. So below the heart there will be a congestion, and because of this congestion there will be atrial flutter, or we know the bradycardia, tachycardia. So all these are the clinical manifestations of this arteriosclerosis or atherosclerosis. If this condition called as arteriosclerosis or the atherosclerosis, if it is occurring in the blood vessels of the heart, then there will be congestion cardiac failure, or we may get a heart attack, like that. So there are various clinical manifestations because of the presence of high levels of cholesterol in the blood. Now there is one more condition which is called as hypocholesterolemia. So which means low levels of cholesterol. So which are termed as hypocholesterolemia. Uh, so there is a lot of research into this condition, and the causes of this state is relatively limited, but some studies suggested that a link with the depression, cancer, cerebral hemorrhage. In general, the low levels of cholesterol will seem to be a consequence rather than a cause or an underlying illness. So, but still, what happens if there is a low levels of cholesterol? So, if there is a low levels of cholesterol, we are unable to synthesize the required amounts of various steroidal hormones like progesterones, estradiols, testosterones, like that. So if there is a low levels of cholesterol, may lead to a low levels of these steroidal hormones as well as the glucocorticoids or the mineralocorticoids or vitamin D3, like that. So if there is a low levels of all these things, definitely we will become fragile. Thank you.